see the typical disproportion you see in lipedema patients. She is very small in the middle and she has an enormous amount of lipedema on her legs. And her situation is something special because she had bariatric surgery and massive weight loss afterwards, and so she got lifting operations of the abdomen and of the legs already, and here of the thighs already. So we have a very complex situation here with a lot of lifting and skin which is not in the place where it used to be and stuff like that. But you see here the typical lipedema fat on the front side of the leg. You see that on the inner part, the fat here in this area is already removed for the lifting operation. But you see the typical lipedema fat below the knee, which is here. And you see a lot of fat around the knee area. So today's operation, we are going for the front side of the upper legs, and in addition to that, we will treat the front side with body tight. So I will do the markings now. If I mark the legs, what I always mark is the lateral side of the quadriceps muscle, which is about here. I always mark that because by the time the patients lie down on the table, the skin flops to the side, and then you don't really know where the front is or where the side is. So this is why I always mark these areas, no matter if the person is skinny or not so skinny. This is what I always do. This is where we will end today. Normally in this area you always have this bulb of fat, and I always end below it. Today it's a different situation because of this skin removal already. So, and then I take the green one. The green one is always to mark areas where I don't want to go inside too often, or areas like this where there's less fat than on the other side, or I mark dents with it or bones or whatever. So, and then I set a straight line on the lateral part of the leg. I always mark like the biggest point of the fat, and then do this and this. When we do the front side of the leg, this part will only be removed for 1/3 because this fat, 2/3 come from the back and 1/3 only comes from the front. So to treat all of the saddlebags, you always have to do the front and the back side, and the back side belongs actually to the back of the butt, kind of. So we treat this with the next operation from the back. Same thing on the other side. Go a little bit up to the upper body to get a smooth situation. And from the back, not just stand straight. And look it from the back. Same thing, when you put the leg on the table, everything flips around, and so I know where the line is from the back. It's very important not to kind of drop into this, but because you need this for stability of the buttocks. We address that with the next operation, and when you see her from the back, you can see that the saddlebags, most of it comes actually from the butt area and from this area, so this is why we treat it with the backside operation next time. So turn around again, please. Yep. So we take pictures now. This is what I need the iPhone for. Hello everybody. Now I would like to show you the in-between result. This means the front side of the right upper leg is treated, in the left side of the right upper leg, there is about 600 milliliters of luminescence liquid inside, so it's a little bit bigger than it was before, and the right side is finished. So Tina will come around, and here you can see the difference. This is the non-treated side, this is the treated area. You see that here, if you touch the skin, you have a very small layer of skin with a healthy layer of fat under the skin. The whole side is treated up to the side. Here, this is where all the liquid stays inside. This is why it looks like this. You see here the lateral part of the quadriceps muscle, and if you look down on the lower legs, you see the massive difference between this area where it's already treated and this area where all the lipedema fat is still inside. And if I bend the knee, you see now this is the normal line of the knee. You see the muscle line here, you see the skin is dropping to the side now. Of course, there is excess skin right now. This is what we expected, and this is what we're going to treat with the BodyTite later. And if we have a look at the fat, we see this one is already finished, so this is 2 liters of pure fat, and in this, the phone is ringing, and in this you see the fat, but this is not finished yet. It needs a little bit more time to settle, and then we have the total amount of fat. So I think altogether we will be something below 4 liters each side on this side, and it shouldn't be more because then we reach out to the 10% max. So I'm going to do the second side now. Hello everybody, now we're finished with both front sides and we have a look at it. You see now both sides are finished. You see how everything is going smooth down to the knee area. We see the lateral line of the quadriceps muscle on both legs, and what I did, I checked the skin on both sides to see whether it's the same amount of tissue I have left everywhere. We have a look at this one. So you see here now the muscle line, you see the knee, and you see how much lipedema fat is on the lower legs. If we have a look at the fat, we have almost 4 liters on this side as well. So now we're gonna start with the BodyTite.